to start by acknowledging the leadership provided by Your Excellencies, Executive Governors in your states around combating COVID-19 pandemic. I also want to acknowledge the leadership provided by the Secretary to the Government of the Federation and Chairman of the Presidential Steering Committee on COVID-19. Next, I would want to appreciate the enormous support of the co-chairs and other faith leaders since March 2021, when we commenced the vaccination against COVID-19 in Nigeria. We are truly grateful to the NIREC co-chairs who have been in the forefront of promoting COVID-19 vaccination in their respective faith communities and indeed the entire country. I want to again recognize the incredible role that our royal fathers have played in ensuring that there's correct communication about COVID-19 and COVID-19 vaccination. Your royal fathers, we deeply appreciate the role that you have played in ensuring that we are successful in reaching out to communities. It is on the very important occasion of the first year anniversary of our eradication of the wild polio viruses that I want to again emphasize the fact that we couldn't have eradicated wild polio viruses from Nigeria without the leadership provided by our traditional and our religious leaders. So once again, we thank you very much and congratulate you on our 1-year anniversary. The global outbreak of COVID-19 was officially declared a pandemic on 11th of March 2020, and the timeline in which its vaccines were rapidly developed due to desire to save lives have been traced by a lot of apprehension and controversy, fueled by large-scale misinformation and disinformation. The scale of this misinformation and disinformation has rightly been described as an infodemic, causing widespread confusion and risk-taking behaviors that can harm human health. I dare say that the faith community has also been enmeshed in these infodemics. Unfortunately, some of those engaged in these unwholesome acts include some of our highly respected faith leaders. Although the anti-vaccination elements are in the minority, by their acts, they are putting the larger society at risk. Nevertheless, we are greatly motivated in our efforts to protect our people by the support we are receiving from the leaders of the two major religions in Nigeria, Islam and Christianity, across the country. Our strategic approach to mobilizing the communities for vaccination at the National Primary Healthcare Development Agency and the Presidential Steering Committee has always involved consulting widely with stakeholders at national, state, LGA, and community levels to ensure effective participation and collaboration in our planning, decision-making, and implementation processes. My presence here today is in furtherance of our consultative approach. Your distinguished NIREC Council members, ladies and gentlemen, despite the intensive and extensive anti-vaccination campaigns, I am pleased to inform you that in the first phase of the COVID-19 vaccination rollout, which was closed in the first week of July, we utilized all of the 4,024,000 doses of AstraZeneca vaccine we received from the COVAX facility in March 2021. We successfully vaccinated 2,549,599 eligible persons across the 36 states and the FCT, with 1,416,406 fully vaccinated. We did not record any case of death associated with COVID-19 vaccines. However, the country recorded 14,550 cases of mild to moderate adverse events following immunization, and only 148 cases were considered to be severe. This is a testimony of the severity of the safety of the COVID-19 vaccine. I want to reiterate that there was no death directly linked with the vaccine. So the vaccine does not cause death. We want to acknowledge that people can have side effects, but most of these side effects are mild to moderate. For the second phase of our strategic vaccination rollout, we have received 3 brands of the AstraZeneca vaccine. Moderna vaccine donated by the United States government, which is about 4,080,000 doses, 699,760 doses of AstraZeneca vaccine donated by the United Kingdom, and 177,600 doses of the Johnson & Johnson vaccine out of the 39,800,000 doses procured by the federal government through the African Union. For the Johnson & Johnson vaccine, which is a single dose, we are using Geographic Information Systems, GIS, to map out the hard-to-reach areas across the states, such as security-compromised areas, riverine, nomadic, and border settlements, where these vaccines will be deployed for targeted vaccination. We are targeting these areas with the Johnson & Johnson vaccine because of geographical constraints that make it difficult to reach the people with the second dose after the first contact. But apart from that, it is infinitely cheaper to go once to a community and vaccinate the people rather than go twice. The current stock of AstraZeneca vaccine, which we have begun deployment to the state, is to be used as second dose for those who received their first dose during the first phase to ensure they are fully vaccinated. Consequently, the administration of the AstraZeneca vaccine has commenced and will close by the 5th of September. The President of CAN and the Executive Secretary mentioned the fact that right behind the hall we have vaccinators that are there. So for those who have not taken their vaccines, this is an opportunity for you to actually get vaccinated. I would like to reiterate my call to those who have received the first dose of the AstraZeneca vaccine before July 8th, 2021, to visit a designated vaccination site from the 23rd of August to the 5th of September to receive their second dose and become fully protected against COVID-19. What we're doing differently in the second phase and subsequent phases in the primary healthcare services integration, known as the whole of family approach. This means that, like previous speakers have mentioned, we are cognizant of the fact that it's not only COVID-19 that is the health challenge of Nigerians. So when you go to any health facility, clients that go for the COVID-19 vaccination will be given health talks to improve their knowledge of the vaccine and vaccination. And for those who are 40 years and above, they will have the opportunity to check their blood pressure and also be assessed for the risk of diabetes. While children from 0 to 12 months will be screened for malnutrition and vaccinated against childhood diseases such as measles, yellow fever, hepatitis, and poliomyelitis. While those who need further medical attention will be referred to the appropriate hospital for additional assessment and treatment. There is no gainsaying the fact that the federal government is committed to providing safe, equitable, and effective COVID-19 vaccination to all eligible persons in the country. All COVID-19 vaccines approved by the World Health Organization are safe and can provide adequate protection against the disease. Distinguished council members, ladies and gentlemen, I urge those of us yet to receive the vaccine to endeavor to get vaccinated at the end of this meeting in order to protect yourself, your families, friends, and the faith community. As you step out of this hall, again, I say the vaccination team is there. Beyond getting vaccinated as individuals, we will continue to count on NIREC as an independent and influential body of eminent Nigerians to promote COVID-19 vaccination among faith leaders and their followers. We also hope that our religious leaders will also call out and hold accountable those among them who engage in misinformation. Finally, even after the vaccination, we have to continue to observe the COVID-19 prevention protocols by continuing to wear face masks, observing hand hygiene, physical distancing and avoiding crowds and unnecessary travels until we achieve herd immunity. Distinguished council members, ladies and gentlemen, I thank you for this opportunity. God bless you. God bless NIREC. God bless the Federal Republic of Nigeria.
Thank you very much, sir.